Hello health defenders, Dr. Borja Bandera here, your Spanish physician and endocrinologist. Today we talk about the famous anti-obesity drugs or weight loss injections as they are popularly known. We are going to see what they are and how this category of drugs work, what they are used for besides losing fat. I will tell you when and how to use them and if they have many or few side effects. Leave me your doubts in the comment below and don't forget to subscribe to the channel. At the end of the video I leave you a reflection and afterthought that is interesting to listen to, especially if you have a weight problem. These drugs or family of drugs, because we are not talking about one drug but several, are called GLP-1 receptor analogues. GLP-1 is a hormone produced in some cells in your digestive system called L cells, which are located in increasing density from the duodenum to the colon. This hormone binds to its receptor and performs more than interesting actions. It increases insulin production when you ingest glucose. When we eat carbohydrates and these reach the digestive system, GLP-1 acts on the pancreas, stimulating insulin production. But if we do not eat carbohydrates, this action does not occur. This means that the drug does not produce hypoglycemia or low blood sugar, because it only raises insulin when glucose also rises. And you will say, is this not bad that insulin is elevated? No, it would be worse if you ate carbohydrates, these were transformed into glucose and absorbed, but insulin was not produced because it would generate a hyperglycemia, high blood sugar levels. In fact, diabetic patients do not produce enough GLP-1 in response to intake, and it's one of the factors that worsen glucose elevation. It decreases the production of glucagon, a hyperglycemic hormone. Glucagon is released in fasting or low glucose concentrations by a group of pancreatic cells called alpha cells. It decreases appetite by slowing gastric emptying and acting on the brain. This is the most important action in terms of weight loss. It improves glycemic control, that is why it's prescribed in patients with type 2 diabetes. It protects your cardiovascular system. It has cardioprotective effects. It does this because it improves insulin sensitivity, the health of your blood vessels, or cardiac contractility. But what are GLP-1 receptor analogues? This natural hormone you produce has a problem, an enemy we could say, which is the enzyme DPP-4, which inactivates GLP-1 in 1 or 2 minutes after it's produced. That is why we say that endogenous GLP-1, the one you produce, has a short half-life. So what are GLP-1 receptor analogues? Well, they are drugs that mimic the actions of GLP-1, but are released much more slowly, escaping the action of DPP-4 and achieving very beneficial effects on weight and glycemic control. What these drugs are? Saxenda, liraglutide. It's used in obesity and it's the only one currently approved in Spain only for obesity. The others are used in type 2 diabetes with obesity. Victoza or liraglutide, Trulicity or dulaglutide, OZEMPIC or semaglutide, RYBELSUS, which is semaglutide too, but you take it as tablets, they are not injections. Wegovy, which are semaglutide injections, and in the near future tirzepatide or Mounjaro, which achieves large weight losses of more than 20% of initial weight, comparable to bariatric surgery, very outstanding, but not available yet, coming soon. As you've seen, except for RYBELSUS, their administration is subcutaneous, which is why they are called injections, but it's a very simple self-administration which does not hurt and does not generate problems. Benefits in obesity. The reason why these drugs have become so popular is because they are effective and make you lose weight. In some patients more and in some others less, but they help you lose weight. How do they do it? For one thing, it makes your stomach empty more slowly. This prolongs the feeling of fullness and makes digestion of food slower. This means that with little you eat, you will notice a great feeling of satiety, which will also be maintained over time. The result is that you will eat much less than you used to. You start eating and before you know it, you are satiated. On the other hand, this hormone also acts at the brain level, decreasing your appetite. Patients report having less cravings, more control over what they eat, and above all, that it allows them to diet without suffering so much. And those of you who do intermittent fasting manage to finish the fasting window with hardly any appetite. Let me know in the comment if this has been your experience. benefits in type 2 diabetes. But these drugs are not only prescribed in obesity, but also in type 2 diabetes associated with obesity. In fact, they are anti-diabetic drugs, just like metformin or dapagliflozin. These drugs manage to improve glycemic control, which is reflected in the glycosylated hemoglobin, a protein that we doctors use to see whether the patient has good or bad sugar control. On average, it manages to lower the A1C by 1 or 1.5%, which is quite significant. By delaying gastric emptying, it will also slow down the absorption of carbohydrates. In addition, by making you lose weight, it will also improve sugar control. Side effects. Are there any side effects and contraindications? Well, like all drugs, it has side effects, but it must be said that it's a fairly safe family of drugs compared to others. As contraindications, they cannot be given if there is a risk of malnutrition or insufficient energy intake, which is not the case in obesity. There are still doubts as to whether they increase the number of biliary colic or gallbladder problems, and as the most frequent side effects, we have nausea, vomiting, and diarrhea, which occur when we eat more than the stomach can accept when being treated with these drugs. As a final reflection, I want you to be very clear about the role of pharmacology in the treatment of obesity and in the treatment in any pathology that depends directly on your habits. Medications are tools and they have good things. There are people who do not manage to change their habits for whatever reason, and we have to help those people as well. But there is a hidden risk in the use of this type of drugs. In psychology, they call it external locus of control. And it's that many people unconsciously put the expectations of improvement in the drug, in the surgery, or in the medical procedure, forgetting the important thing, which is the modification of their behavior, which is always much more difficult than taking a pill or getting an injection. And finally, remember that it's not a first-line treatment, and your doctor will prescribe it only if you have not managed to lose weight and fat by changing your lifestyle. Moreover, whether you manage to maintain the weight loss once you stop the treatment will depend on the changes in your habits that you have implemented. And finally, they are expensive drugs and subject to medical prescription. If you found this video useful, don't forget to share it and subscribe to the channel. See you soon, stay healthy and strong.